Let me share my screen. Okay, welcome to you all. Welcome to you all. Thank you for being a part of our presentation tonight. My name is Dr. Dieter, and I'm a board certified internist and a board certified pediatrician. And today I'm going to go through how our chronic medical conditions are rooted in chronic diseases we face are rooted in an energy shortage, which we call metabolic dysfunction. So, there is now more and more evidence that all the chronic diseases we face in modern day society are the result of two things, something we call insulin resistance and microbiome dysfunction. These two things together, result in uh, something we call metabolic dysfunction, which is just simply a fancy medical term to say energy shortage. Okay. And that energy shortage then drives the metabolic dysfunction, which is the energy shortage, then drives all the chronic diseases that we face. So, insulin resistance and microbiome dysfunction cause metabolic dysfunction, energy shortage. That energy shortage results in chronic diseases. A simple definition for a disease is a cell that has malfunctioned or a group of tissues or group of organs that have malfunctioned. And the number one reason why a cell malfunctions is because it doesn't have energy. So modern day diseases coming from a shortage of energy called metabolic dysfunction. Now, I want to take these two things, insulin resistance and microbiome dysfunction, flesh out what those two things are and how they feed into the energy shortage that result in the chronic medical problems. So there is now insulin resistance. When we talk about insulin resistance, what is insulin resistance? Insulin resistance is simply a fancy medical term to say that your insulin is not working well. You see, insulin is a very, very important hormone in the body. I consider insulin hormone numero uno in terms of importante. There is no hormone that trumps insulin. And the reason why insulin is that important is because as a hormone, it performs a particular function. It is, I call insulin the CEO of the body. It dictates the smooth structure and functioning of the body. And why is that? Because of this job of insulin. The job of insulin is to do this, is to mobilize glucose out of the blood into the cell. You see, when we eat, the end product of what we eat when absorption occurs is that glucose is released in the blood, and this is the cell. So insulin's job as a hormone is to get that glucose out of the blood into the cell. When insulin gets into when glucose gets into the cell, it goes through a complex series of reactions. It's fed into the mitochondria, which is a spatial organelle in the cell, and it goes through a complex series of reactions called the electron transport chain, with the result being the release of an energy molecule called ATP. ATP standing for adenosine triphosphate. This is just an energy molecule. Every cell in the body requires energy to function. Every tissue, every organ, every system. And when there is not energy, the cell malfunctions. So, why do we consider insulin to be so critical, so important, the CEO of the body? Is because without insulin, we cannot make energy. And when you do not make energy that the body needs to function, the cells malfunction, you have a disease. So When we say that you have insulin resistance, or which means your insulin is not working well, is when there is a breakdown in this process, when insulin cannot do its job of mobilizing glucose out of the cell into the blood, out of the blood into the cell so that energy can be made. Anywhere where there's the breakdown in this process, we say you have insulin resistance or your insulin not working well. And when that happens, you develop conditions like this. So, diabetes, a lot of people hear insulin, and the first thing they think about is diabetes. Diabetes is just one of the branches of the root of the tree of insulin resistance. When your insulin is not working well, your body cannot make energy. When your body cannot make energy, the cells, the tissues, the organs, the systems that require energy to function malfunction. A simple definition for a disease is a cell that has malfunction. So this slide, unfortunately, is not big enough to be able to encompass all the diseases in modern day society that come as a result of insulin resistance. It's not exhaustive. It's just a simple depiction. Now, how do you go from your insulin working well to not working well? What causes this breakdown? And the breakdown happens in a two-step process where your insulin goes to not working well. And the first process is what we call too much fat. That's how your insulin gets to not working well. Number one, you have too much fat. Now, um, how does too much fat result in the breakdown in insulin not working well? I'll show you like this. Our cells are supposed to look like this. When you consume way more calories than you're supposed to consume, so this is a cell, a normal cell. When you consume way more calories than you're supposed to consume, the body takes those excess calories and converts those excess calories into fat. The body now takes that fat and goes and lumps that fat into this cell. I'm drawing a replica of this cell. So this cell that is normally supposed to look empty like this, all of a sudden this cell is filled with fat, what I call a fat laden cell. Okay. Now, when this cell is filled with fat, normally when glucose is in the blood, insulin comes and tells glucose, the cell, I want you to take up glucose. The cell says, I'll be happy to. The cell takes up glucose. But now you now have this fat laden cell because excess calories have been converted into fat and have filled the cell. What happens is that when glucose comes to this, when insulin comes to this cell and tells this cell, hey, I want you to take up glucose from the blood, the cell tells insulin, I'm sorry, I don't have any room in the inn. I'm filled with fat. If I bring glucose in, glucose will have no place to lay its head. I have no room. So the cell refuses to open its doors, for glucose to come in at the knocking of insulin because it's filled with fat. And what this cell is doing is it's trying to protect itself from excess energy. If you have ever eaten too much on Thanksgiving, you feel so full. When you feel that full Thanksgiving stuffed, the last thing in the world that you're thinking when you've overeaten on Thanksgiving is to put a bite of anything else into your mouth. Even if that bite of anything else is your grandmother, your favorite pecan pie from your grandmother, you're stuffed, you're disgusted with how full you are. That's exactly how this cell is feeling. The favorite food for the cell is glucose. In fact, the cell needs glucose to survive. The cell needs to bring glucose in so that glucose can be used to make energy. But this cell is so filled that it doesn't take in its favorite food. So what happened is you cannot make energy. So that's the first way in which your insulin not working well. The second way is that what happens because glucose cannot get into the cell, glucose now accumulates in the blood. When glucose accumulates in the blood, it triggers the pancreas to produce too much insulin. There is a one-to-one relationship between the concentration of glucose and the amount of insulin produced by the pancreas. So when your glucose is high, it causes the pancreas to produce a high amount of insulin. So the pancreas now produces too much insulin. And too much insulin is the second way in which your insulin, which that affects how insulin does its job. How does it do that? Now, remember, I described insulin as the CEO of the body. It dictates the smooth structure and functioning of the body. When insulin is running too high, think of it like a CEO that was normally supposed to dictate the smooth structure and functioning of a company. He comes to work one day and he has gone cuckoo, he has gone crazy. He's backing out on reasonable orders, shoving people left and right, coming to somebody and saying you're gonna do it my way or the highway, firing people for no good reason. He becomes a bully and a tyrant. And when that happens, the employees of that boss are gonna lose their respect for the boss, and they're less likely to be excited of to do something that the boss asked them to do because they have lost respect for the boss. You translate that to the cell. When insulin is acting too much, insulin is acting as a bully and a tyrant to the cell. It's yelling at the cell. When insulin is too much in the blood, it's yelling at the cell in a loud tone. The cell doesn't take kindly to the loudness and the bullying, that insulin is giving it. So what happens is that the cell loses its respect for insulin because insulin has become a bully and a tyrant. Insulin that needed to be a CEO controlling how the body works, the cell has lost its respect. When the cell loses its respect for insulin, the cell is less likely or less amenable to do what insulin asks it to do. So when insulin now asks the cell, open your doors this wide so that I can let glucose in, because the cell has lost its respect for its CEO, the boss. The cell is reluctant to open its doors. The cell may, instead of opening its doors this wide at the knocking of insulin, the cell opens its doors this wide. So a narrower door means that less glucose is going to come into the cell. If less glucose comes into the cell, the implications of that is more glucose remains in the blood. That more glucose that remains in the blood causes the accumulation of more glucose in the that more glucose that remains in the blood increases the concentration of glucose in the blood and triggers the pancreas to produce even more insulin. And even more insulin is like adding fuel to the fire. So imagine you had a boss that was crazy. He had gone crazy to this level, and the boss now raises his cuckoo-ness, his craziness to this level. The employees of that boss lose even more respect for the boss, and it's harder and harder for the boss to influence them to do anything. Translate that to the cell. When insulin is now running even higher, the cells lose even more respect for that high tone of insulin. And when insulin says, open your doors this wide, the cell now opens its doors this wide, even an even narrower door. The even narrower door triggers more glucose to accumulate in the blood, and you have a vicious cycle. That's one. Now, um, so the other thing on here that I talked about was number two, microbiome dysfunction and how it plays into the energy shortage that drives the diseases we face. To be able to understand what microbiome dysfunction is, you have to understand what the microbiome is, which is a group of 30 to 100 trillion bacteria that live in the large intestine. And these bacteria live in what we call a symbiotic relationship. We do for them, they do for us. We're supposed to provide food and shelter for them, and they're supposed to perform all these functions for us. I want to highlight a few functions that this bacteria in our gut are supposed to do. They're supposed to help protect the gut from disease-causing bacteria. Pathogenic just simply means disease-causing bacteria. And how they do that is the production of a special fatty acid called a short chain fatty acid, which cannot be obtained anywhere. You cannot eat it, you cannot get it from supplements. It's only produced by this bacteria in the gut. These short chain fatty acids are like concrete, cement. You see, the cells of the gut are linked together one to another like this to form the wall. So where my fist comes together is what we call the tight junction of the of where one cell meets with another. So these short chain fatty acids go and are like concrete. They go and pour concrete on this place where my fists meet together to tighten the wall so that the wall is not weak. Because if the wall is weak, bacteria can seep in through the weakness, the leaky gut into the blood and cause an infection. The other function I want to highlight is that the microbiome helps to train our immune system. 70% of the body's immune system resides in the gut. The other 30% of the immune system resides in the bone marrow, the lymphatics, the lymph node. And these bacteria are responsible for training them. When the bacteria is healthy, what it does, when the microbiome is healthy, it trains the immune system in a healthy way, which looks like this. Hey, you see that bacteria right there? He's a bad dude. You could probably take him out with just a simple stone. You don't need to drop a grenade in his backyard. Just a simple stone will take him out. You see that other bacteria right there? He's a bad dude. If you use just a simple stone, you will not kill him. You need a grenade. Drop a grenade in his backyard to take him out. Do you see that other guy right there? And the immune system says, "What guy?" He said, "That guy right there." And the immune system is finding it hard to see the guy's head. And the microbiome says, "The reason you cannot see that guy right there is because he's in camo, he's in camouflage. But that guy in camouflage, be careful with him. He is not the enemy. He is a foe. He is not the enemy. Uh, um, so when you see him, don't fire any bullets at him or what have you. So that's part of the body cells. Now, when the microbiome is not healthy, it trains the immune system to be hyper reactive, to shoot first and ask questions later. It trains the immune system to have its trigger on the or its hand on its finger on the trigger, ready to act. And it may look like this. Hey, you see that bacteria right there? He's a bad guy. But you know what? You could probably kill that bacteria with a stone. But why take him out with a stone when he's a bad guy? Just, drop a grenade in his backyard, make a splash, boom, make an explosion. So a bacteria that could have died with a simple David sling on a stone, it uses a grenade to kill the bacteria. Overkill, which causes inflammation and issues. The other thing, man, like, hey, you know what? You see that guy right there? It looks like he's in camouflage. He may be, I don't know whether he's the enemy or whether he's a friend. You know what? I don't got time to figure that out. When that, let's just blow his head off. We'll take him to the autopsy table and determine whether he was an enemy or whether he was a friend. So a cell that is in camouflage, that is the body cells, it now unleashes an assault on that cell, and that's how you develop autoimmune diseases because the microbiome is unhealthy. Now, what then do we call, now that you understand what the microbiome is and its functions, what then is dysbiosis, another name, microbiome dysfunction? You see, the bacteria in the gut live in a 50-50% population. So 50% of them are what we call the bad bacteria, and the other 50% of them are what we call the good bacteria. Okay, they balance each other up. We say you have dysbiosis or microbiome dysfunction when there's an imbalance in this population. Maybe the bad now become 70%, the good now become 30, the good now becomes 70. Sorry, the bad now becomes 70%, the good now become 30. An imbalance in that 50-50. And why does that happen? That happens when there's a shortage of food. When there's a shortage of food, it sets into motion survival of the fetus. You see, the food for these organisms that live in our gut, are fiber. is fiber. And when we do not consume enough fiber, there is shortage. And our foods are so processed, we're not consuming enough fiber. So when there's a shortage of fiber intake, what happens is the bad bacteria are the stronger bacteria. The bad bacteria, what they do is they're gonna take survival of the fittest sets in. It's just like when if you're in a hurricane area, you go to the announce that there will be a hurricane. You want to go to the grocery store. All the bread has been cleared off the shelf. All the milk. All when we were in COVID in the pandemic, there was survival of the fittest mentality. That's what happens here. The bad bacteria now hoard the little fiber that is there and keep to themselves. And then they say to increase our for us to keep a hold on this little food that is there, let us go ahead and increase our army so that we can keep a hold on this food. And then they now increase to 70% at the expense of the good bacteria that goes to that. When you have this, but when you have that imbalance, we say you have dysbiosis or microbiome dysfunction, and it drives many chronic diseases that we face today. And I want to highlight that say that again, this list is not exhaustive. We cannot put all the diseases that are related to dysbiosis or an imbalanced gut. But I want to highlight two things, several things. You see, this Hashimoto is an autoimmune disease when the microbiome attacks the body cells. Lupus, autoimmune disease. MS, autoimmune disease. Celiac, autoimmune disease. So autoimmune diseases come from an unhealthy gut. The other thing here that you may be surprised to find is anxiety and depression linked to the gut. There is a hormone called serotonin. Serotonin is what we call the happy hormone. It helps maintain our mood, okay? 90% of that hormone is produced in the gut. 90%. The other 10% of that hormone is produced in the central nervous system, the brain. So if serotonin is responsible for maintaining our mood and 90% is produced in the gut, when the gut is unhealthy, it cannot put out this 90%. So you have anxiety, you have depression. So this slide here represents what I call the metabolic sequence of inflammation, where insulin resistance and dysbiosis cause chronic inflammation, and that chronic inflammation drives the diseases and symptoms that we face today. Now, there is just as much evidence now that if you were to reverse the core of the problem that caused the energy shortage, reverse the insulin resistance, and reverse the dysbiosis, the conditions that were the fruit of this go away. And I like using this analogy. If you have a car and you're driving in the car, and the car runs out of energy, the car is gonna stop. The car stops not because of intrinsic failure of the engine, but the car stops because its energy source is gone. When the car stops, if let's say you walk to the nearest gas station, you buy a gallon of gas and walk back to your car on the side of the roads and you put gas in that car starts working again. Why? Because its problem was energy. You gave it back its energy, and it's the same with the body. It's so simple but so profound. The simple definition for a disease, I'll say it again, is a group of cells, tissues, organs, or system that have malfunctioned. The number one reason for malfunction of cells, tissues, organs, or system is the lack of energy. When you restore the energy balance, the malfunction goes away. So we now have profound evidence that you reverse the insulin resistance and dysbiosis that cause the energy shortage and put energy back into the body. Those diseases go away. And there is now a solution which has become my very favorite solution in helping people to be able to restore and reclaim their health. It's called the Feel Great system. There is this health company that asked the question, why did our ancestors 100 years ago not suffer from these chronic diseases, and answered the same question. It had to do with the nutrients they took in, special phytonutrients found in food. Food is medicine. And they said, what if we could go find the phytonutrients that maintain the health of our ancestors and package those phytonutrients into what we call a nutraceutical, and give people to be able to restore their energy balance. And that's where this idea was born. A nutraceutical is a product made 100% from plants but has health benefits that far outweigh the nutritional benefits. And there are two products in this. For those of you who are on here who are maybe in healthcare, you may be a pharmacist, you may be a nurse, and you're joining us for the first time, or a doctor, you will be astonished to know that both of these products are listed in the physician's desk reference, the PDL. So if you were to go online and look for these products, you will find them in the PDL. Now, let's talk about this. What they do is they go to the heart of the problem. Remember, the reason we have all these chronic modern day diseases are the result of energy shortage stemming from insulin resistance and dysbiosis. You reverse that, the diseases go away. So both of these products go to the heart of the issue, reversing the root cause. We talk about the first product, Unimate. It's made from a plant that is native to South America called the yerba mate plant. This plant is very rich in a special phytonutrient called chlorogenic acid, which is a polyphenol. What polyphenols do is that they help the body to be able to burn fat. A fancy medical term we say lipolysis, that says burning fat. Now, and because of that, that helps to reverse insulin resistance. Why? If you will remember, the first way in which your insulin went to not working well, insulin resistance, was this cell that was filled with fat. So when you consume the Unimate, which promotes fat burning, it now causes this cell that was laden with fat to start burning the fat in the cell. And this cell, the fat burning may occur to the point where now this cell first goes from looking like that, to looking like this. It has burned most of the fat in it, but it has freed up all the space in the cell. The glucose that was hanging out in the blood that was high now can now enter the cell. As lipolysis, fat burning continues to occur because of the Unimate, this cell now goes to looking like this. It now goes back to looking normal, like it's supposed to do in this scenario, like that. Now you have all this free place in the cell. Glucose can now enter the cell. When glucose enters the cell, now glucose can go through the electron transport chain, resulting in the production of energy. Now, what that happens is that because glucose enters the cell, is going to cause the concentration of glucose in the blood to drop down. When the concentration of glucose in the blood now decreases, it now triggers the pancreas to switch from producing too much insulin to producing a low amount of insulin. Okay, and low amount of insulin is like a CEO of the company who had gone crazy, who comes to work one day, he calls a meeting to his employees to apologize and says, hey, I know that I have been a jerk for the last 2-3 months, having unreasonable demands, firing people left and right. I am very, very sorry. Please forgive me. I'm going to make amends for what I do. The employees are taken by the humility, the apology. They forgive their CEO. They regain their respect back for the CEO. And now when the CEO asks them jump, they say how high, because they now respect the CEO. You translate that to the cell. When the concentration of insulin in the blood now goes low, insulin has now become humble. It's no longer acting like a tyrant and a bully to the cell. And it comes to the cell and says, hey, I am sorry. The cell says, you know what? I could work with that humble insulin. And now the cell, now when insulin asks the cell, open your door so I could let glucose in, the cell says, how wide do you want me to open it? Letting as much glucose to come in to go through the electron transport chain to produce energy. Now, that's what the Unimate does. Fiber, which is the second part of the product, balance is just simply a product made rich in fiber made from 7 different plants. It's called balance. It does exactly the same thing to reverse insulin resistance by causing this same process of lipolysis. It causes fat burning and so causes this cell to become free. So they kind of reinforce each other. Now, the other thing that fiber does is that fiber helps to decrease your glycemic index. Translation, fiber helps to decrease your glucose spikes. And why is that important? That is important because of this. Fiber slows the digestion, the transit of food through the colon, and decreases your glucose spike. So if you and I went to an Italian restaurant to have lasagna one evening, and we both order a plate of lasagna, and you know nothing about fiber, that fiber can blunt your glucose rise, make your glucose not to spike too much, and you order your plate of lasagna and eat it, your blood sugar is going to do this. And that blood sugar may be a blood sugar of 180. For me, I'm lucky. I know a thing or two about fiber. I know that this product is high in fiber. I consume that first, and then I eat the same plate of lasagna, exactly the same plate of lasagna, because fiber slows down the transit of food, slows carbohydrate absorption. It's going to cause my blood sugar. I eat this, consume the balance, and I eat the same plate of lasagna. My blood sugar is going to do this. And that spike in my blood sugar may be a blood sugar of 90, despite the fact that you and I have had exactly the same plate of fiber to eat. Why is that important? The implications of that is that because you produce a blood sugar of 180, your pancreas is going to produce a commensurate higher amount of insulin. Your pancreas may produce 20 units of insulin to bring that 180 down. For me, because I have only produced 90 milligrams of glucose, my pancreas is going to produce a commensurate lower amount of insulin to bring that glucose down. So for me, my pancreas may produce 5 units of insulin to address that blood sugar of 90. Why is that important? I want you to think about high insulin 20 units as the crazy CEO who the employees lost their respect for. When your insulin is running high, your cells lose respect for it. Your cells are less likely to answer the door when insulin knocks to say, bring glucose in. A low insulin 5 units here is like the humble CEO, level-headed CEO who runs the company well, who the employees respect. So that is the implication of fiber. The last thing, and that plays into reversing insulin resistance. The last thing is that fiber helps to reverse dysbiosis. You see, in this slide, I mentioned that I left this out because I wanted to mention here, but when I talked about dysbiosis, I said the food for the microbiome is fiber. When you don't have fiber, it causes this imbalance. Every living, and the balance is high in fiber. So when you consume fiber, you're nourishing the microbiome. Every living organism, whether it's a lion in the jungle of Cameroon, where I'm from, or a bacteria in the gut, as long as it's a living organism, it needs chow, it needs food. And the food for the microbiome is fiber. So by just consuming this, which is high in fiber, our foods are so devoid of fiber, you feed the microbiome and you reverse dysbiosis. And I end by saying that the feel great system has become, since I learned about this as a physician, it has become my favorite tool in helping patients who have any of the chronic medical conditions as a result, of the energy shortage to reverse those conditions. So I end by saying that if you have any of these conditions or any chronic medical condition, this list was not exhaustive. There is good news. You can reclaim your health again with the a reversal of the core of the problem. So thank you guys for listening. I'm going to stop sharing my screen and then uh, yield to our moderator. Okay.
All
Dr.
right.
Tiffany.
Yes, yes.
Okay.
Hello, hello, hello. And for all of you that are on this call, if you are just like I was paying attention, even though I've heard this like more than once, you got to admit that was a good presentation. So definitely show some love in the chat for Dr. Dieter right here, because he did a good presentation, putting it all together, making it clear, talking down to us, not talking in doctor speak, talking to it to where we can understand it. And so I appreciate that. Now, what everybody loves to hear about is, so where are some results? So let's look at that. And I got some nice before and afters I wanted to show. And before I do that, I guess I need to explain myself a little bit. Who am I, right? So I am actually a double board certified physician in family and lifestyle medicine, practicing for 20 years. But I just wasn't fulfilled just giving prescriptions. I want to see people actually heal and get better. The lifestyle changes, some people latched on to, but some people needed more than that. I got certified in lifestyle medicine about going after the root causes of conditions. I ran across our mutual friend, and she introduced me to some products to help my people make the lifestyle changes. And once I tried it for myself, got off of my blood pressure medicine, able to help my brother actually get off his insulin Trulicity, his metformin, and then hundreds of other people and thousands by extension, which is why we say we want you with us, because we are on a mission to help as many people as we can. So here I am talking about this right with Dr. Dieter. So let me show you some people that I've gotten to meet and spend some time with who have used these products. Some have really done the lifestyle changes, and some have really just relied on the products. One thing about the products is they turn off the carb noise to where you eat better without even thinking about it. You start to exercise because you have the energy. So one of our friends here was able to lose 100 pounds, but the big picture, especially for me, is because I'm trying to help as many people as I can get off of medications. She was able to get off of all her medications after being on them for 20 years. Okay. That's huge. That's huge. Okay. And so I like to show this too, because so many people are like, well, I don't have to lose weight. I don't have diabetes. How do these products even relate to me? Well, because we deal with the inflammation side of this that Dr. Dieter so eloquently explained, acne even gets better. Even not even just acne, even psoriasis can get better. Okay. Then we have somebody like Cody here, who after 6 months was able to lose 70 pounds. And he really just used the products mostly and got rid of some toxins that he was involving himself in. And this made a huge difference. But when you incorporate the fasting, we see that the skin also bounces back over doing that over a period of times. And that's that whole autophagy thing that happens with fasting. Darren here losing 66 pounds over 30 weeks, but he also improved things like acid reflux. And so we're always told you're going to be on a medicine for that. Even when the diet doesn't totally fix it, you have so many people still stuck on those acid reducers, but he was able to reverse that entirely. IBS, no longer pre-diabetic, normal cholesterol, better focus. Kendall here, a young mom. I actually just saw her on the cruise. She looked fabulous. But not only that, it also helped her mental health. So dealing with anxiety, depression, IBS, all those things improved with using these products because they started treating the gut. And Dr. Dieter went over this already. Type 2 diabetic for 23 years, 7 months using the products, was able to get off of all of her meds. And she's 73 years old. So there is no age limit to this. It doesn't matter how old you are. So many people feel like they're stuck in a place because, I'm this old, I can't change. That's not true. These tools help you kind of nip that in the bud or give you the push you need. Jackie here was able to lose 104 pounds and is still keeping this off. And she also reversed her pre-diabetes. I love Tanya's story here because in 5 months, she went from having an A1C of 10 to 5.6. So just out of the range of pre-diabetes, right? And then she was able to get off of her diabetes meds, her blood pressure meds, lower her cholesterol. But the big picture here, she was carrying around an oxygen tank all the time, 24/7. She no longer has to do that 24/7. Coach had some kidney issues, blood pressure issues, was able to lose a good bit of weight, but able to improve his blood pressure and his kidney function. And Keith's on the call now. And so, he has this great picture. He's going to tell us this story about his weight loss. And I'm not going to steal his thunder because his story is big and we're not even going to get to his real picture yet. But Keith has some great improvement here. And we can see that in these pictures. My friend Heidi here, she was one of those that said, I'm not losing any weight. And then said, well, let me just look at a picture. Oh man, I made a big difference because you lose inches. Sometimes you don't even see the movement on the scale, but you will notice that your clothes fit a little looser. And then when you start looking at things like a composition scale, then you can see the fat actually decrease. And our illustrious speaker. I love this. I love this just because one, I understand that picture on the left here. That's a tired physician. Okay. I mean, so many of us understand how that feels. I understand how that feels. But at stage 2, he's already making lifestyle changes. He's running, right? He's doing intermittent fasting. And yeah, he looks better, right? But what a difference 3 makes. That's after 2 months on the protocol. And so, like I say, it just amplifies all the lifestyle things you're doing. So I have some people that are like, I'm doing all the lifestyle changes and I'm still not where I want to be, because you actually need to treat your gut a little bit better, because it's hard to do that in our eating environment. And you need those herbs. Okay. Again, I like to fly past this one and skip this because I don't know who that lady is, right? It's like, who's that girl? But no, a stressed mother, a stressed mom, a stressed physician, a stressed career person. And that takes a toll on us. And when we start actually doing these tools, it helps us even deal with the sleep. It helps us deal with the cortisol things. I mean, so many things improved with being on these products. And so I was able to go for my blood pressure medicine. I said that, right? Yeah, I did. And then Dr. Esther, same thing. And you don't have to be a doctor to use these products or see their benefits. But again, we understand what being stressed is like and trying to manage everything. And she even wanted to take her picture in the same dress to prove she looked good. And skin tags. I love this one because this is the thing. Everybody's like, oh, this was my girlfriend that swore she was the healthiest person ever. She was like, no, I don't have this problem. This insulin resistance thing is not me. I'm the healthiest girlfriend you know. But she had skin tags. And so she was like, okay, well, let me see. I'm take these products for 90 days so I can prove you wrong. And sure enough, she took a picture because she was determined to prove me wrong. And then on June 24th, she was like, okay, some of these skin tags are actually getting smaller and coming off. Okay, there's something to this. And it is. And I love this picture here. This is Crystal. She's a nurse. Struggled with Hashimoto's. In fact, her antibody levels were like in the 2000s. It was crazy. But after using these products, she was able to get them down under 8. Under 8. And not only that, getting off of 13 meds, off of 13 medications. So that's why I do what I do. I've got to work with Jim, who actually reversed his A1C from 12.2 to 4.8. That's full reversal, remission if people don't like reversal, right? That just means he's not on medications anymore, not dealing with type 2 diabetes anymore. Migraines, insomnia, IBS, high blood pressure. Those are the things we're doing and why we are here. So I think this is a good segue to my friend Keith. Keith, I hope you're getting ready. I hope you're getting ready to be able to tell your story, sir.
Always ready. Well, I'm not a doctor, not a physician. I'm just every random, just random Keith, I guess. Um, well, before I started taking the protocol, to put it bluntly, I was a hot mess. I was a train wreck. I had so much going on. It was mind blowing. I was type 2 diabetic for 25 years on insulin 95% of that time. Increasing level of insulin and meds over the years to where I got up to 15 medications a day and 6 shots a day. I had neuropathy. I had my cholesterol was out of whack. My blood pressure was triple digits, both numbers. Um, I was the heaviest I'd ever been. I was up to a 50-inch waist. I had autoimmune disorders. I was getting injections in both eyes at one point to try and curb the bleeding in the back of my eyes. And it all came to a head in January of this year when I physically passed away. They were able to bring me back, and I passed away on the day of my daughter's gender reveal party to find out I was fixing to gain a grandson, and I was this close to not being around for it. I had foot wounds that wouldn't heal. I mean, it was just a mess. And when I started the protocol, I started it on June 12th, right after my grandson was born. And in the first day, I noticed that's the foot ulcer that killed me. The first was when they found it in January, or actually like right before Christmas last year. When I went in the hospital, that's what it looked like. And then after uh 2 months of hyperbaric chamber to the tune of $180,000, and then 2 months of wound vacs and knee scooters and boots. That's the second pictures where it was at about 2 weeks before I started the protocol. And after I started the protocol, it was healed within 6 to 8 weeks. But
Wow.
after 3.5 months, that's what my foot looks like now. Totally healed. Um, and it literally has saved my life. My A1C I've struggled to keep it under 8 forever. Um, and when I came out of the hospital, it was 7.5. But once I started taking the protocol on day 2, I was off all my insulin entirely, 108 units a day, done. Within the first 60 days, my depression had gone away. Um, I'd lost 50 pounds. I'd lost, I think at that point, 9 inches on my waist. Come day 90, I was off all my medication, all 15 meds. Um, I was down 65 pounds. I'm now down over 70. My waist has decreased by a total of close to 12 inches. Um, I went from a size 52 to a 52 to a 36.
Wow.
Um, I no longer get injections in my eyes. My eye doctor, in fact, told me the last time I saw him, he goes, he hasn't seen my eyes look this good in over 4 years. My eyesight's improved. I don't need to wear glasses unless I'm driving. I wear them when I'm driving just for long, long distance viewing. Um, but yeah, I went from a 4X shirt down to an extra large. I mean, it's crazy. I haven't felt this good in over 20 years. I feel probably 10 to 15 years younger than I actually am. I'm in my mid 50s. Um, when I first got introduced to this, people were telling me looked like I was in my mid 60s, and now I could pass for 40. So I mean, and my joint pain is gone. I've had surgeries to try and fix nerve issues, probably 8 in the last 3 years, and none of them really, I mean, they helped, but they didn't fix the problem. Once being on the protocol, I couldn't sleep in a bed. I had to sleep in a chair. Now I'm sleeping in a bed and I'm sleeping throughout the night. I was that guy that got up every hour or two. I was going to the bathroom nonstop. It was a complete train wreck. And this protocol has given me a renewed hope for the future. I'm no longer thinking I'm not going to be here in 2 years. I'm thinking I'm going to be here 20 plus.
Yes, yes, I love it. And you know what's so crazy? You look so good, Keith. So many of us were like, "Did I see Keith? I don't know if I saw him on this trip we just went on." It's like, where was Keith?
One person recognized me. And some of these are people that I see almost on a daily basis or talk to. And eh, my mentor I stood right next to him, had no clue who I was. It was wild, to be honest with you.
I know that's a good problem to have. I will say that.
Yes.
But that's what Anne Marie likes to say is, in 90 days you're unrecognizable. Well, Keith proved that to be true. Okay, right there, right there. Now, Keith, tell us how you actually worked this protocol to get all these great results. What did you do?
What I did, I was that guy that went to McDonald's every morning. I took my pills, went to McDonald's, and did my thing. Um, the product is simply you get 2 teas and a fiber, and that's your daily. That's all this protocol is. You mix up a tea first thing in the morning. It helps. It curbs the food noise, so you don't you know, I skipped breakfast and I'm a breakfast guy and I stopped eating breakfast and I didn't eat till after lunch. I mix one of these teas up. I sip on it every 5 to 10 minutes until lunchtime. And then if I feel like eating, I eat. And then I mix up my second tea and I sip on it until dinner. And then right before dinner, I take my fiber matrix, I slam it down, and I eat a good green leafy salad. I put olive oil on it, good healthy fats. Then I usually what I have for dinner is either mixed veggies or green beans, something of that sort. I'll eat that, and then I'll go on to my protein. I'm a big egg guy from loving breakfast, so a lot of nights I'll have eggs and sausage. Um, and then if I want carbs at the end of that, I can have carbs. I still love carbs. Um, I just don't eat them nearly as much because the fiber helps fill you up, keep you feeling like you're full, so you eat a little bit less. And then after I eat, when I couldn't walk, I had bought one of those under your desk little stair stepper things, and I fire that up and I hang a backpack off the back of my chair and I just sit there and exercise for about 20 minutes, or I'll go out and have a walk. And that has made the entire difference.
I love it. I mean, that's simple. It really
Yeah,
doesn't have
I
to be
mean,
that
it's
hard.
really insanely simple.
I love it. I love it. So I love your story and I love hearing it every time because I think it gives people hope who believe that there is no way back. There's no way back from one, dying. You literally died on the table. There's no way back from those ulcers, and you have that story. So you have that story of hope and restoration, just like Dr. Dieter put in the comments. And I love it. I love it every day to hear your story. So thank you so much, Keith.
You are very welcome.
Now, while Keith is transitioning and we're going to get Dr. Dieter back on here, I hope you guys are getting your questions ready because this is the one few time you're going to have two doctors, two double board certified doctors on here, ready to answer your questions, happy to answer what we can, knowing that, we may not have all the answers, but with our heart to help as many people as we can, we are ready and willing to hear what you have to say. So bring it on, bring it on.
Yes, we're open for questions about this.
Here we are. And then sometimes you need a little time to get your questions together. So I do hope you reach out to the person that referred you to this call because they do care about you enough. That's why they put you on here.
Hi, Dr. Dieter and Dr. Tiffany. If
Hey,
someone just got a hip replacement surgery, can they just go right onto taking the Unimate and just continue the protocol? They stopped like a day before, and then 3 days. It's been like a week after the surgery. Can they just continue?
Absolutely. So what I like to say, and when I have questions like this in regarding to when to take where or if you can take it or not, I like to always go back and say that this is food. This is just special food that helps your body to make energy well. The products that these products that these products have been made 100% from food. So in the same breath, I'm going to ask, can somebody after surgery go back to eating? If the answer is yes, yeah. Because this is, remember I said this are nutraceuticals. They're made 100% from plants, and food is medicine. So um, there is no issue or what have you as to, okay, when can I start back after a surgery? If you can eat food after a surgery, you can take this after surgery.
Thank you.
I think Grace has a hand up. Grace?
Hi, thank you for giving me the floor. Good evening, everybody. So this is my first time of hearing about your products, and I'm very touched with the presentation that you guys made. Now, I am somebody who eats a lot of carbohydrates. And when I heard from the testimony of, I can't remember if his name was Mark or not, and his lifetime modification, it entails him not pretty much eating carbohydrates. So if you are somebody who eats a lot of carbohydrate, how does this protocol work for you? Is what I wanted to ask. Do you have to completely cut off carbohydrate, or cutting your normal carbohydrate intake to half versus a quarter of what you normally consume? Is that something that is recommended, or what?
Okay. I'll let Dr. Tiffany answer the question and I could add on something.
That is a wonderful question. So one thing I do like about these products is you don't have to change anything. What Keith actually said was he didn't change a thing. So, okay, I say that to say because some people aren't ready to change, and it sounds like you like your carbohydrates a lot. So I think starting the products consistently would be a good place with you. One thing about these products is you meet people where they are. That's how I try to do this, is meet people where they are and coach them where they are. And so if that is a big issue for you, I don't want you to feel like you have a resistance to the products, because you don't. But once you start sipping the yerba mate drink, the carb noise, your desire for having all those carbs start to decrease. And then not only that, because you're doing the fasting and you're adding this drink, you're boosting your GLP-1 hormone. That's an hormone in your that actually gets released by your gut. So even the fiber helps with that too. But it also turns off the carb noise and the food noise, and it allows food to move slowly. So it becomes harder to want all those carbohydrates. So I used to think of it as my way to transition my people who were absolutely against making changes, because after a month or two, they were all over the less carbs without even thinking about it. So I would say just starting the products consistently and letting it do its job, and you'll find that it'd be easier to pull back on those carbs that you love so much.
Yeah,
Thank
Grace.
you.
And Grace is gonna add to that. Grace, are you from West Africa?
Yes,
Where are you from?
Cameroon.
Okay, I want to give you this example. I love chin chin very much. Okay,
Oh, yeah.
my mom just visited me a couple of months ago, brought a big bag of chin chin. What Dr. Tiffany was talking about, right? There are carbohydrates and then there are carbohydrates. Most of the carbohydrates that we consume, unfortunately, are refined grains, the chin chin, the pasta, the bagels, the what have you, which are not great for us. Our body knows what is good for us and what is not good for us. Food is medicine, and in the same breath, food can be poison. What I noticed while I was on them, I used to be somebody who liked to eat a payday every day, and I ate chin chin every time I saw it. Okay. When Dr. Tiffany talks about turning off the carb noise, especially the unhealthy carbs, what this does is it goes and reorders your biology so you don't have to make that decision. So I was shocked that I will see a payday and not care for it. Or see, I have gone now 7 months without eating a payday. I ate a payday candy every day. I have no desire for it. My mom visited me. There's a big bag of chin chin, in my garage. I haven't opened it. She may come back, she comes here every 2 years. She may come back and still find that bag of chin chin. But before that, that bag of chin chin will be devoured, but my biology has been reordered with the system, that it has turned off the noise. It's not that I have a strong desire. It's like willpower, that I've just made a strong willpower and I'm not eating the chin chin. No, it's that the desire is no longer there for that unhealthy stuff. Are there some other carbohydrates that I still love and still eat? Oh, yeah. I eat pizza. We have a family tradition of eating pizza. I like rice. I eat rice. But a lot of the unhealthy carbohydrates, I've turned the noise off. And even the unhealthy ones that I eat every once in a while, pizza, I eat that together with my balance, and it keeps me good. It's so you don't have to give up your carbohydrates. The system is going to help you give up the unhealthy carbohydrates, by just turning that noise off. You like your rice, you like your fufu yam and what have you, or fufu corn, you wouldn't have to give that up, and this will still benefit you.
Thank you.
Mhm.
Okay, I think Asong has her hand up. Asong, go ahead and tell us your
Yeah,
question.
I asked a question in the chat. I don't know if you're able to see it.
Was it the question about the GLP-1?
Yes.
Yes. Dr. Tiffany, I'll let you take that question. The question was, can you take this with the GLP-1?
Oh yeah, you absolutely can. Um, and so I mean, as far as it having any, there are no known drug interactions, right?
Okay.
But I've had people tapering off of those GLP-1s and using these products to help them taper off without any problems. You have more side effects with the GLP-1 itself, more than you do with these actual natural products. So if you want to have your doctor involved because you will need them to taper off, I definitely urge you to have your provider involved so that way you can start tapering off your dosages. But yeah, I have plenty of people doing that.
Another question is with the, what's that one? Is it Ultimate? The one that makes your stomach so full? Sometimes when you take it, is it okay if a client can take just half of it? Because sometimes when you take it, it makes you, I don't know, it just gives you some uncomfortable feeling in your stomach.
You talking about the Unimate or Balance?
Balance.
Okay. So the Balance, right? Are you talking because of your experience?
From my experience,
Okay.
yes.
How long have you been on it?
Well, I'm not consistent.
Oh, that's okay. Okay. You're not consistent. Great. How long have you been on it in total? Even
About 2 weeks. But
okay.
I don't take that particular one consistently.
Okay, that's the problem. Let me explain to you something. That's the problem. We are as a man or a woman, you're a woman, you're supposed to consume an average of 25 grams of fiber a day. Okay? The US, the NIH estimates that the average woman consumes 10 to 12 grams of fiber a day. So our foods are so processed. And think about fiber, as think about fiber uh, as a weight. Let's say you go to the gym, you have not lifted weights in 10 years, you start lifting weights. You want to do a bicep curl or something. When you introduce that fiber into your body, it's now contributing to about 28 grams of fiber, whereas your colon has been used to lifting only 10 grams. Okay. So, so
That
there,
makes sense.
um, uh, your colon has been used to lifting only 10 grams. In that situation, your colon is in shock. You're exposing your colon to way more fiber than it has ever been. So I want to guesstimate or estimate that probably for the last 10, 20 decades of your life, you have not been consuming an average of 30 grams of fiber a day. You now start consuming this, your colon has to get used, kind of acclimatized to it. And it's in that process, you're giving a bicep that has only been used to carrying 10 pounds, now carrying a 35 pound. It's going to take time to get strong, to adapt, and what have you. What is happening, that bloating, the fullness, the uncomfort, is your colon, which was used to, which is supposed to be seeing that amount of fiber, has not seen that amount of fiber in decades. It's in shock, like, whoa, what's this stuff Asong is giving me here? It has to acclimatize. So that period where you're feeling bloated or full or this and that is an acclimatization period that your colon is getting used to. Unfortunately, Asong, every time that you stop, you're not consistent, you go back to level zero. Once you start taking the fiber, that quantity, you're training your colon to get used to the fiber load. If you take it one day and don't take it for 2 days or this and that, you cause your colon to go back to class 1 for training, like level 1 all over again. If you were consistent for the next 2 weeks, your colon acclimatizes to that, those symptoms go away.
Yep, 100%. Now, sometimes decreasing the dosage can help a little bit, but you have to stay consistent. 100%. I agree with that. There were some other questions in here too. What's this other one? It's saying there's someone in here with a family member with prostate cancer and was asking if this could be taken. Oh, there's something else too.
Yeah, absolutely. This can help with prostate cancer is driven by, so 10 to 30% of cancers are the result of bad luck. The other 70% of cancers are due to metabolic dysfunction, and insulin resistance sits at the heart of it. You know what? All the cancers that are driven by metabolic dysfunction, they have one food that they eat, glucose. When your insulin is high, there is a lot of glucose that the cancer can eat and feed and thrive and worsen. So by by cutting off insulin resistance, you start depriving the cancer of its food. So somebody with prostate cancer is going to do better because the food source of the cancer, the glucose, is being cut off when you have insulin resistance. So the way I put it is that it improves your survival chances. It improves the chances that you're going to beat the cancer, because you're starving the cancer of its main food to continue to grow. So absolutely recommend it. If that was my uncle or father or what have you, I'll have them on it because it chokes the cancer of its main source of food.
Right. Yes. And there was another one that I passed over asking about the heartburn.
Yeah, the heart, let's see, I also saw that. So customers of heartburn, even diluted so far. What I will say to that, because I've had a few customers, one or two, who have had heartburn with this. What I will say to that is, if you persist, some of the heartburn is probably more common with the citrus than with the that I've noticed with the orange, the orange flavor than the balance. I don't know if Dr. Tiffany, if you've noticed that. But what I will say, I'll go back to acclimatization. The balance, I would say, just continue taking both, and when your colon acclimatizes to that, is going to calm down. It makes me wonder if that person is because Unamate should not cause heartburn. If you were telling me, is the balance causing heartburn, something is off. Unamate does not cause heartburn. Balance, yes, may, but not the Unamate. So I go back on that. So I will encourage them to get back to taking the Unamate. I think it's probably the balance, that is causing that. But the good thing about that is there is a getting used to process to an acclimatization that you continue taking that and it goes away.
The other part I've noticed too, so with the Unamate, it ends up when insulin comes down, we lose water. And so we also lose electrolytes. Adding back the salt helps people even with this heartburn stuff. Because actually heartburn is more of an issue of not having enough acid, really. So that salt helps you want to make some of that acid back. And I've actually tried this with people and it does help. So I don't know if that's the state that they're in. And if just adding some salt back would help, because since they've been on the products for a while, they may be losing more water and more salt than they realized. And it usually needs to be something like Himalayan sea salt or Celtic salt, not just your iodinized table salt, not that one. Or we have our new product out, the Signal. That'd actually be really good to use in that instance.
Yeah. Any other questions we're missing? Celtic salt,
I
good.
think Carol said she had a question. So Carol, if you're still here, unmute. She had her hand up in the chat.
Okay. Hey, Carol, we're ready for you.
Hello, good night to you.
Hello.
How are you?
I'm good. Good night too.
Yes, I probably get on a little bit late on the chat, but what I'm hearing so far, I'm liking it. But my question is, my husband have a wounded legs. It's swollen. Both legs have been swollen for a period of time, and he have been back and forth with the doctor, and the medication that they are giving is not helping. Well, it's I have a coming up appointment that he had to go and do a surgery on them to see that they found out that there was a clot in the leg, a blood clot in his legs, and that's what's causing the swelling. So is this medication that you are talking about here would be of any help towards him?
So it may help his other issues, if he has any other issues. Now, what you have explained to me makes me understand that he developed a blood clot in his leg that was significant enough that caused plumbing issues, the flow of blood and things in his leg to go out of sort that then caused the swelling.
Yes.
So these products, will not help the blood clot or what have you. The blood clot has to be evacuated to help with the swelling. But if it's possible that the swelling is also coming from uh, heart failure due to insulin resistance, some people have more than one thing going on. Okay, so
Mhm.
he has congestive heart failure and has swelling in his legs because of congestive heart failure. Congestive heart failure, which is your heart not working well, is as a result of failure of specific pumps in the heart, sodium, potassium pumps in the muscles that weaken the heart, that come as a result of insulin not working well. So I'm not saying that he does. I don't know, but if it's blood clot related that resulted in this swelling, this wouldn't. If he has any other issues related to insulin resistance, this will help him. Is he on medicines for anything?
Okay. Well, we just found out the clad last week, and he's gonna do the surgery
Yeah, it's
this week.
medication,
Yes.
anything.
So and how long does he would have to take this medication that you are talking about for it to be of help to him?
I need to find out. Is he on medications for anything, Carol?
Yes, yes. He's also taking blood pressure medicine, and he's taking he did have a prostate, he do prostate cancer a couple of years back, and he's still taking that prescriptions for the water flowing of the body to keep.
Okay.
Yes, so those are the medication that you have been taking.
Yeah, so this will help his blood pressure. This will help to keep his prostate calm. What I would say is, I answer this question like this: food is medicine, and this is, by the way, this is not medication. This is
Mhm.
nutraceutical. I know you say it as a layman. How long does he have to take this medicine? I just want to correct that this is not medicine.
Okay.
Nutraceutical is 100% food, made from plants. Is food. So
Mhm.
I usually answer this question like this: food is medicine, and food can be poison. Okay, we have to eat food every day. Why not eat the right food? So that's what I tell all my patients. So if you can eat the right food every day, you don't need this. Maybe one in every 3,000 Americans eats the right food every day.
Well, as according to his eating, we are Caribbean people, so we generally eat mostly like greens and less starch and stuff like those because we used to those things. So
Yeah. What
yeah.
Yeah, what I would say is, if your husband has high blood pressure, he has a root cause issue, insulin resistance. That is coming from a particular lifestyle. You know, so I've been a physician now for 11 years. And a lot of times I see people, I say, what do you eat? Oh, I eat healthy. When I start asking them what they eat, you know, I realize that they're eating a lot of refined things. And when I tell them this, oh, I didn't know that was not healthy for me. I didn't know. So the term we eat this may be ambiguous because what you may think is healthy is actually not healthy. A lot of people are shocked to find out that something like, you know, the oil we use to cook, the canola oil and all that stuff is not.
Mhm.
So things like that. But I'll just simply say that if your husband has high blood pressure, he has a disease coming from metabolic dysfunction, you know, and that comes hugely from what you eat or don't eat. So to answer the question again, the simple thing will be we're supposed to eat food every day, right?
Yes.
Why not eat the right food? And this is medicine. This is food to your body, which acts as the right food every day. That's how I answer that question.
Okay. Thank you. So how do we get, how will I get this food system
Okay,
that you are talking about?
wonderful question, Carol. Who invited you?
Miss Sabla Davis.
Miss who?
Sabla Davis.
You should get in touch with her. She's going to help you.
Okay.
Mhm,
All right.
mhm, mhm. And let's not forget the 90-day money back guarantee with these food products. So you literally have 90 days to take them and prove us wrong.
All right. Thank you.
You're
All
welcome.
right.
Okay. Well, if there are no other questions, we're very glad that you joined us today. We do this now 2 times a week on Sunday and Monday at exactly the same time. So if you listen to the call today and you said, oh man, I wished my brother who has diabetes was here, or I wish my mother who has sleep apnea was here to listen to this, or what have you, invite them to the next call on Sunday at the same time we'll be talking about this. And we are always looking for people to join our team. There are not enough of us telling the world out there that these diseases are reversible. We are always looking for people to join us to echo this message so that as many people as possible can reclaim their health. So if this sounds like a mission that interests you and you will want to join our team in helping people to be able to restore and reclaim their health, reach out to whoever invited you to. We can use your help. Thank you.
Mhm. Yes, thank you.
All right. Good night and thanks again.
Question, doctor, before you leave. Is there a test that you do? Because I know sometimes they have some specific tests like that you can just do on a patient, right? To just see how they're doing metabolically,
Oh, yeah.
check cardiac health.
No,
Do
no,
you have something like that?
just like that. For the purpose of this, I cannot go into the details. Functional medicine doctors do that. You know, I run a functional medicine practice. I have a huge metabolic panel of tests that I send on people to have a sense of their metabolic profile. There are numerous tests like that. Okay.
Okay.
Where are you located?
I'm in Lanham,
Where? What?
Maryland.
Maryland.
Yeah, the you could get with any functional medicine doctor in that area, and they test that could be done to get what your metabolic picture looks like. All right. All right. Thank you guys very, very much for joining us, and look forward to having you guys bring on some more invitees on our next talk. Good night.
Good night.